Well, for many women and men, pregnancy can be a roller coaster of emotions and nerves. Because let's face it, 9 months, well, it's really more like 10 months, let's be honest, is a long time to wait to meet your baby, and the journey isn't always easy.
No. It's sometimes a rocky road. Now, a national helpline is using video calls to help put expectant mums and dads at ease. Midwife Diane Zalitis runs the service. She joins us with mum-to-be, 38 weeks and counting, Sally Stroutons. Diane, to you first. This sounds fantastic. So it's a phone service, but a video phone service. And we were just talking about in the ad break, so people at home realise it's kind of like Skype. So you can use it on your phone, you can use it on your computer, and we can Skype you. It's free.
It is. You access it through the Pregnancy, Birth and Baby website. So there's just a simple button that you click on that will then connect you through to the service. It tests your internet connection, your camera, your microphone, so that you know that you're secure to go through. And then it connects you through to the counsellor. The difference with our video call service to Skype is that it's secure and confidential, so nobody else can access the call. And this is important because when you're pregnant and you're wanting to speak to someone, you're talking about really personal issues, yes, and you don't want your personal information to be accessed by anyone else out on the wide web. And when the call ends, it disappears. There's no memory of it, if you like. There's no record of it out there. Yes, no footprint.
Sally, you've used it. Yes. Tell us what some of the concerns or queries you've had.
Yeah, just most recently I used it when we're getting pretty close to D-Day, and my obstetrician, who's been wonderful, had said to me that I'd been having Braxton Hicks, and I went, okay, understand. And then, of course, I didn't really understand when I got home exactly what that involved and exactly what I was going through. So you get onto Google and it's a bit of a minefield with all the different pregnancy websites, but finding a site where you can actually call a 1-800 number to be able to talk to a counsellor and explain to them this is exactly what is going on right now, and have somebody say, yes, what you're experiencing we believe is Braxton Hicks, and if your symptoms change, to go and see a doctor or midwife. It's just really reassuring to have that at the end of the line. And
I think the video component for this is really important, Diane, because because it goes after pregnancy as well, doesn't it, for 12 months after pregnancy. So especially if you're a first-time mum like Sally's about to be, you need that sort of reassurance. Sometimes at 3 in the morning, like, what is this sound? What is this smell? Can you hold the baby up to the camera? And you guys can help reassure.
Certainly one of the most common calls through to the Pregnancy, Birth and Baby service is about nappies and what's in them.
What is the smell?
And is that supposed to be there? Absolutely. So, and we have, because we offer both the telephone service and the video, it allows parents choice. And certainly sometimes, you know, at the end of the day, you might have had a really bad day and not got to the shower and not got your hair done and had your makeup done lovely, and you may not really want to be seen on the video, so you can use our telephone and call and speak to our counsellors. We provide lots of practical information for people as well as emotional support, and there are plenty of things that you may not feel comfortable at talking about with family and friends that you want support with.
Can I say which is important, because I remember the first time of leaving a hospital with a baby, and you might remember this too, Georgie, there's so much going into, you're going to have a baby, guess what, this is how you do it, da-da-da, and then you leave hospital and go, thanks a lot, bye.
Yes.
And unless you've got a support network, mothers or grandparents, it doesn't help. It
doesn't. You get home and then you go, now what do I do? What do I do with my baby when you walk in the front door? Where do I put it? What happens now? No, there's nobody here to tell me what to do. What do I do with it?
It's so true. Can you just elaborate on who's taking the calls? They're obviously qualified in their field.
Absolutely. We have qualified counsellors, they're psychologists and social workers background. They've also specialised in the field of pregnancy and early parenthood. So that's their field of expertise. That's what they're passionate about, supporting women and families wanting to become pregnant through their pregnancy and obviously at home with their baby when they're 12 months old.
Sally, do you think that, you know, I mean, it could be any time now, it could be in a minute, but do you think you'll be using this service once you get your beautiful new baby home?
Yeah, look, I think the video component of it is amazing. I mean, a picture says 1,000 words, and being able to actually talk to somebody and show them exactly what's going on and understanding whether you do need to bundle bubs up and get down to the GP or not is a really amazing peace of mind.
Diane, just quickly, you say 25% of calls come from dads.
Yes.
What are they asking about?
All manner of things. And it was interesting, the previous story about changing nappies, but about, you know, what do I do as a dad and what practical things can I do to support her, but also the relationship stuff. So what do I say when I come home from work? What should I not say? You know, she's been at home all day with the baby, you know, you walk in the door from work, The last thing you should say is, well, what have you been doing all day, honey?
Yeah,
you know,
yes.
the dishes haven't been washed and there's laundry not been done. And, you know,
that's
that's
brave man who goes down that path.
First time dad errors.
Congratulations.
That's a great
Fantastic opportunity for mums. And Sally, best of luck.
Thank you very
Sally.
We're very excited for you.
Oh, what a journey.
much. Countdown's on.
Oh, good luck.
Thank you.
Wonderful news. All right. And if you're ever seriously worried about your baby's health, of course, nothing replaces going to a GP
Yes.
or your obstetrician. But if you did want to try out the new National Video Call line, you can go to pregnancy-birth-baby.org.au to find out more.
Great service.
So that was a TV spot that we were fortunate enough to get back in March, talking about one of our services. What I wanted to talk to you about today, hopefully it's fairly clear from the title, is, you know, what's going on with people out there and Dr. Google and how Healthdirect and our suite of services can support you and support you supporting your patients and your practice and your family. It's kind of an all, hang on, point that there, service. Okay, so this morning I just want to talk about who we are, what services we provide for the Australian public, who pays for it, and then how you can use these services in your daily work and at home. So Healthdirect is a COAG funded company, which means we're funded by all of the governments in Australia, the Commonwealth, states and territories, various services that we provide. And that means that all of our services are free to the consumer. There might occasionally be phone charges, but essentially they're free. There's no cost for anything, and we don't sell anything to anybody. So we're not for profit. We were established initially in 2006 and called the National Health Call Centre Network, and that was to provide a national nurse triage service. And just on the nurse triage service, Queensland and Victoria, if you're from those states, you'll be well aware that you provide your own nurse triage service. So 13 Health in Queensland and Nurse on Call in Victoria. But the nurse triage Healthdirect line covers the rest of the country. And so our objective is really about providing Australians access to safe, valid health information via the telephone and online, and in an equal format so anyone can get to it. And that's to support them in making the right choices about who to see at the right time and in the right place. And we have grown from running the nurse triage line to running a whole bunch of stuff, of which I'm going to show you on the next slide, so don't go cross-eyed when you look at it. So we have, and I won't go into all of these in depth, but I will show you screenshots and we'll go onto the website and have a look at it. We provide a variety of services to different states, including Queensland and Victoria, even though they run their own nurse triage service. So we have the Healthdirect nurse triage line. We still have the after hours GP line, and if you're aware enough about what happened in the budget, that ends at the end of June, but it's still a national after hours GP helpline for the country at the moment. The pregnancy, birth and baby service that you saw on the video. We have Mind Health Connect, which is a website and a gateway portal to services to support mental health. My Aged Care, which is also a website and a contact centre, and the Get Healthy service, and then we have the National Health Services Directory, and I'll talk a little bit about more of them as we go through. And just on that, in your bags, on your chairs, we have information about all of these services. You can write as much as you like, but you don't need to write it all down. And I'll show you where you can get more information about all of these at the end as well, because we provide free promotional material, so you can order anything around our services, and there's no charge for the materials and there's no charge to have them delivered either, which is a bit unusual usually. Okay, so some statistics about Healthdirect and who we are. So since inception, and this slide's a little old, so we're probably closer to 5 million calls through the nurse triage line. We've had 1.3 million visits to our Healthdirect website over a year. On pregnancy, birth and baby, first trimester is the most popular page on the website. A year ago, our after hours GP line had hit 500,000. I think we're closer to 750,000 calls since it's been operating. Every 36 seconds, our nurse triage line takes a telephone call from somebody, that's a lot of calls. So yeah, there's a bunch of stuff that we are looking at. My Aged Care's had close to 150,000 visits since it started. So there's a lot of people at least getting to our bits and pieces online and through the phone. So this is a few little questions to think about while we run through these slides. So what about after hours outside of your practice hours? And perhaps even in practice hours if you're fully booked. I'm not, sure how it operates for you and how busy you may actually be. So what do your patients do if they're worried and it's out of hours and they can't get you? What would you like them to do? Where do you want them to go? What's best for them and for you? And how many are turning to Dr. Google? And I want you to think about that because I have the answer to that a bit later. And hopefully you'll have finished your bacon and eggs by then because I don't want anybody to choke when you see how many are turning to Dr. Google. It's quite a surprise. So I've got a few slides about the nurse triage line. Just so you can, this is just showing you age group that they call by. So if you add the first two lines together, which is anyone from a newborn up to 4 years of age, is close to 25% of our calls around really little people, and then it's pretty evenly spread over age brackets. When someone calls our nurse triage line, the registered nurses have evidence-based guidelines and decision support tools. Tools. Did I just say stools then? Sorry. And I didn't go to Bollywood last night and I'm still tripping over. Not everyone heard that. I can see some puzzled faces. So everything's on the computer for them. So there's a significant logic base behind the guidelines. So when they ask questions and the answers take them through to provide a disposition or a care advice at the end. They also give out health information and obviously provider referrals. And the nurses don't diagnose anything. It's really obviously based on symptoms that people call about and they give the best care advice. And we also use the translator service and the national relay service. And just so you know who's on the line for both the after hours GP and the nurse triage, so clearly they're all registered, they have to have had 3 years experience and relative acute care clinical experience for the registered nurses, and they have to have good English skills, and the same with the GPs as far as their registration and experience background. So it's not people who've been retired for a long time and feel like just talking on the phone for a while. Yeah. We have quite a robust clinical review process for all of our services, and this is the one for the nurse triage. So all of our calls, so that close to 5 million calls are all recorded. Every call that comes into any of our telephone services are recorded. That's for all of our auditing purposes, but also if there's any concerns or incidents or complaints or someone rings up and says, well, you told me to do this and it was wrong and this happened, we can listen to the call and we can discover what really happened and if it's actually true, and then we can actually fix what's going on. We do reviews of the guidelines. We're actually running a data matching project with emergency departments in the ACT in New South Wales, so we can look to see what people are doing. So if at the end of the call they're advised they should go to emergency, do they go? And the people we say you don't need to go to emergency, do they still go? And match up, because as you're probably well aware, people don't always do what they're advised to do. And they go for second opinions, and that's usually mum or dad or their friend, but other than another health professional. And we have quite a significant incident and complaint management system as well, so it's all well documented. I just wanted to show you a comparison rate. I found this really quite interesting. This is the disposition is what happens at the end of the call, so the care advice they're given for children, which is under 14 years, and adults. And for the most of it, it's the same, but providing home care, so staying at home, is much higher in children than it is for adults. And then the other distinctive point is in Activate 000 is higher in adults than in children, and that might be all the heart attack ringing up people, perhaps, and see a doctor within 4 hours. So there's some of the endpoints that we send people to. We're actually changing the see a doctor, the 4 hours, and immediately kind of in our system is pretty much the same thing, really, depending on when you can get into them. This is a really, really interesting slide. It's talking about what we ask everyone when they ring up what they were going to do before they rang the registered nurse, and then what the guidelines said they should do based on their symptoms. So in the first box, 10,000 people were going to ring 000. Only 2,500 of them needed to ring 000. So that's 75% of those callers were going to head into the 000 space and didn't need to be, which is overloading the ambulance system. Just under 34,000 were going to go to ED. Only 8,000 of them needed to. And then at the other end, so the people that were going to go to their doctor, there's not as much movement in that. But the people who are going to stay home as well, so 25,000 were going to stay home and look after themselves, and only 5,000 of them should have done that. So there's quite variation in what people think they need to do or intend to do and what they need. So often, the people who were going to stay home needed to go to ED. So it helps, talking to someone really helps people figure out what's going on. Okay, so just before I go into some of our services, I thought I'd give you a little kind of some thoughts about who your patients are and when our services might support their needs for each of ours. And I apologise, I left the abbreviation on the NHSD. That's the National Health Services Directory. So if you're travelling and you need to find a health service, you can have the NHSD on your phone, and you might be in the Kimberley and need a GP, or you might be in Brisbane and you don't live here and you need a GP who's open, or a pharmacy. You might have someone come in who's newly pregnant and she's not sure if she really wants to be pregnant. Who's she going to have that conversation with? And do you guys have the time to have that conversation with her? Our counsellors at Pregnancy, Birth and Baby can do that. You might be looking for a mental health resource and you're just not sure what's available either online or out there, and Mind Health Connect can help you find that. Someone might be wanting to lose that extra bit of weight they've been carting around, and we have a Get Healthy service that can help with that. You might be looking for aged care services. It might be late evening and they don't know if they need to go to ED. They might have a breastfeeding question, they don't know who to ask. Have ageing parents. How many people have ageing parents in the room? And no idea where to begin to navigate the aged care system. Wondering if the symptoms they've got are really worth bothering their GP about, and many, many more. So the National Health Services Directory, this is the app you can get on your phone. It has much more than the general practice pharmacy and ED information. We have broken that down to a lot more granular service provider, but it's extraordinarily helpful if you're not at home and you're needing to find a service provider. It's also, it can also be very useful for you within your practice as well if you're looking to see what else is around, even if it is in Brisbane, or people are needing to go somewhere and you want them to see someone when they're away. Pregnancy, Birth and Baby service, which was on the video. So this is our 24-hour helpline and website. We have call handlers and we have counsellors available for people, and we do pregnancy options counselling and miscarriage support, and right up through to 12 months. So this service takes quite a strong perinatal mental health focus. Mind Health Connect. So this is our mental health portal. So you can actually find, there's a guided search tool, so you can answer a few questions and that will link you through to online support stuff, information, and then face-to-face services that you can send people to. And you can be the health professional looking, you can be doing it for yourself, or a family member can be using this. And there's a lot of free online services that people can access in the mental health space, so it's really helpful for those who don't have a lot of money. And it also links through to the mental health symptom checker, and I'll talk about that. My Aged Care, so that's a Commonwealth funded program, and it's a gateway to get information and guidance around what you're entitled to, where you go, where you even begin. And I think it was last year we had a booth here at APNA, and one of your colleagues came up to me and was terribly excited about this service because it had saved her parents $600,000 just by ringing My Aged Care. Because when they were obviously looking to go into a retirement village, and they were told they need to spend a certain amount of money, and she said, well, hang on, why don't we just ring this and see? And in making the phone call, they discovered they were entitled to other things that saved them that much money. And I can't give you the exact details because I don't understand it, because I'm not at that point just yet of needing to go there, but that's the kind of thing it can do for people, and you don't know. Now, the Get Healthy is a free coaching helpline and website. It's in New South Wales, Queensland and South Australia at the moment. And they are coaches. So people get up to 8 coaching calls and are supported through, diet and exercise and making lifestyle changes to lose weight. And people opt into that, so it's driven by the caller, not by the coach chasing people. So if people are wanting to do it and they're motivated, this is a really good support service for them. And again, it's free, and there's a lot of very good information that they're provided with. And the coaches call them. It's an outbound call service. So now I wanted to talk to you about our online symptom checker for patients, which is probably our newest offering, if I can call it that. And so our objectives with this was to provide good clinical information that's going to safely direct patients to where they need to go. So if they're checking their symptoms online without talking to anyone, that it be user-friendly, and that everyone, including you guys, have assurance that the information they get is accurate, safe and clinically sound. And if you've ever looked at there are a few other things that you can do, a symptom checker, check a symptom online kind of stuff. They're pretty awful. They generally send you to some very generic stuff, and we've had a look at them all before this service. And why did we build it in the first place? And this is, if you'll have a look in the red, and you are eating your bacon now, so don't choke. How many are going to Dr. Google? There are 10 million visits a week to health and medical information websites. 10 million, which is like half our population every week. And 3/4 of those are going offshore. So they're not even getting Australian Health Service information. And we all know how very different everybody else's health system is to ours. So they're coming in misinformed and then confused, which then will set up not the best of dialogue with their health professional, their GP, or anybody that they're talking to. But 80% of Australians are online, and 60% are looking for specific information about their symptoms before they go any further. And I think we can all agree that Dr. Google's not really the best and most trusted source to provide them that information. And because that's what we do, what we're funded to do, to be online and in the telephone space, we decided that we would develop or find a clinically sound online tool that can support Australians in doing this and support the health system. So a symptom checker works within the principle of a patient's medical home, and that's where it encourages them to help themselves where it's appropriate and knowing that it's appropriate, but then also discussing and involving their usual GP. And they're constantly advised to do that. So the symptom checkers aim to work with their GPs, not as a substitute for them. So what it isn't. It's not a diagnostic tool, so they're not going to come out with something saying, yep, you've got diabetes or you've got lymphoma or anything. And it's not a replacement for face-to-face consultation. It doesn't undermine or compete with the relationship a GP has with their patients. Actually aim to enhance that. And it's not about saving money or unblocking beds or freeing up EDs or anything like that, because people will still just go do what they want to do anyway. And it encourages consumers to take responsibility of their health and improve their health literacy so they understand what we're talking about when we're talking health to them. So what do we cover? Now, I've got 2 slides. You can have a go at reading all of these. There are 41 different symptom checkers. And within them, some of them are quite big. So the sexual health and lower body covers male and female sexual health and a bunch of other stuff. So it kind of is under one big heading and it can come out. under that. And we have, some of the headliners: head injury, chest pain, the usual suspects are there: pregnancy, rashes, fever. Okay. Now, before we published this, we had clinical panels that looked over all the content. We got the symptom checker from the UK and we brought it across to Australia, and then we Australianised it and we went through it. So we had a clinical panel. Every panel had an emergency department physician, a GP, an emergency department nurse, a pharmacist, a paediatrician and an ambulance representative. And then we brought in subject matter experts for particular topics. And there are 5 documents. It was each symptom that you saw had a panel that went for a full day. So there was 41 full days just of looking through this information and then going back to make sure the changes were right. So there were wads of paper with flows of, if you ask a question, this is where you end up with, depending on your answer. And is that where we want people to go? And had we missed anything? So that every possible scenario was covered off that could possibly be going on, and we would get people to the right endpoint. So we had significant clinical expertise in the content development. We had editorial overlook to make sure that you could read it and it made sense and the language was really very simple. And we have ongoing review of what's in our symptom checkers. And we've got a bunch of data collection stuff going on. I won't go on that. Okay, just out of interest, the most selected symptoms are abdominal pain. The big one that says 47% is other, so it's all of the others combined together. So abdominal pain is 14.5%. Rashes and skin problems. Sexual health and lower body is the third most picked topic to look at. Diarrhoea and vomiting, and then chest and back pain. It's mostly women who are using the symptom checker, which is probably no surprise because they drive the health of their families, and perhaps looking for children as well. The top age groups are, again, people who are kind of online, so you're kind of your 20 to 50 age group are the top 3, take up more than half of the pie chart. There are a lot of people obviously looking for children. I don't think the 0 to 4s are looking for themselves, or some of them are pretty clever with iPads. They might accidentally get on there, but I'd say it's mum. This just a slide to show you which cities and who's on the most. I should say these were launched in August last year, so they've been alive for 9 months with little to no marketing, so it's people finding it online. So, and this is just to show you how many users there has been up till April, end of April, so 51,000. And again, just people by searching and finding it. Okay, now before we get into this, I wanted to show you we went to great lengths to make sure that there was information for people to take from this and to tell their GP what they had, what to tell the GP when they went to them, so from using the symptom checker. So it actually allows people to quantify what's going on and put it into words that they can take to the GP. And so they have this page, they can print all of this out when they get to the end. And so this is from the abdominal pain symptom checker, and there are various of these depending on how severe their abdominal pain is. And so for this one, it's that they're experiencing abdominal pain and they have pain when they pass urine. And so that's what's causing their pain. They're given information on what to do while they're waiting to get to their GP. The other one. And I'll show you all this live, but there are some tabs across the bottom and everyone has some self-care stuff. So what to do while you're getting yourself to where you need to go. Things like what to watch out for. So that's around things getting worse. So if their symptoms change and get worse, what to do. And there's some general information about that, about the topic. So the objective of the symptom checker is that it can actually give you a lot of assistance when you're talking to patients and for them to really understand what it is that is going on for them when they're wanting to have that conversation with you and their GP. Trying to triage people without guidelines is really, really difficult, and so this gives you a tool to do that, to ask questions, and you can sit and do this with people. We have had amazing feedback from GPs, and the GPs are wanting to put this on computers in their waiting room and just have people go through it and get patients familiar with it and get them to bring their printout. Okay. Now, I am going to show you what it looks like on the website. Does anyone have any questions before I do that? Yep. Oh, sorry, go. Yes, so the question was, because this is being recorded, are we looking to develop it into an app? And we are. And my understanding from our digital services team is that's really close to being finished. It's obviously a lot of, when you see it on the big website, there's a bit of work so that it works on a small device. As far as the rest of our websites go, though, there's a word for it, is that they can work on all devices, depending what you look at, and they automatically set themselves for your device. And there's a proper technical term for that, but I can't remember what it is. But yeah, so there should be an app very, very soon.
So why hasn't it been marketed?
Why hasn't it been marketed? I suspect part of it would be we often do what they call a soft launch, and that's just to test how it works when it's actually up and live and to pick up any bugs and faults in it. We are starting to do a lot like marketing of it and talk at conferences and promote it out there. It's also promoted a bit online, and that's where everybody are finding it. It's not that we want to hide it, but we did want to give it a little bit of time that it didn't crash with a massive amount of people going in, and that it worked the way it was supposed to. When it first went up in that first week, there were a few little bugs. There always is with online stuff, is my understanding from those people, to iron that out. But yeah, we have full intention of pushing it very heavily. Yeah.
What was the rationale for the GP Healthline being canned? What was the...
You'd have to ask Tony Abbott that. Sorry. That's something that's come in the budget, and I don't know. My understanding of what the budget says, and this is probably just based on everything everyone else has heard, is that they are taking the funding that was to provide that national service and giving that funding back to the primary health networks, and I guess then from them back into GPs to provide their own after hours, I guess. Yeah. Yeah. Oh, there's somebody way down the back.
Hi, I'm from WA, and on our post-immunisation sheet that we give our parents, Healthdirect number is the first thing that we direct people to. So I'm quite familiar with the Healthdirect GP line, I guess. Have you thought about doing like a small education module, making a video like you've given us today available to all nurses so that we can learn more about it to then educate our patients more about it? Like, I didn't know about the pregnancy, birth and baby service, and we've got 7 obstetricians who work in our GP practice, and we see antenatal patients daily, sometimes 30 or 40 of them in a day. And there's patients who we would love to refer to that service, but we didn't even know about it. So is it something that you've considered?
It is, and I do believe that they're recording this session, which is why the lights are a little dim, so that I look a little better on the camera in soft light. But we are, so that will be out there. And you're right, there's always, because I have to be careful how I say this, I guess, because we're funded by the government, they tell us how much they want us to promote the services, yeah? But you're quite right, and we do hear that all the time. And health professionals are the group that we're taking a significant focus on getting information about our services in front of, because most people will say, "I've not heard of you. I'd never heard of us before I started to work here for Healthdirect." So we are attempting to do that. And you're right. There are so many women. Pregnant women who've miscarried, women who have so many questions, and having access to a telephone service that's free, a counselling service that's easy, accessible and available, Yeah.
regional area, so our after-hours services are very minimal. So we don't want everyone to go to our emergency department.
No.
It's already overrun. So that's why we do refer quite a lot to Healthdirect for post-immunisation issues if they're not available, and try to encourage other patients to use it too. But yeah, the pregnancy service would be good to get out there.
Yeah, yeah. And so we are working on that. And I guess the other thing is they provide us with a marketing budget, so we have to do the best we can within that. Yeah. Thank you.
Diane, I'm really impressed by the suite of services offered, and I'm really impressed too by the data collection, and I was astounded by that 10 million statistic. So in regard to that 10 million hits on Dr. Google, are the IT people looking at trying to get your site up on number one when people do look for Dr. Google?
Definitely. I mean, that was kind. Yes, we are, and it's a bit of a battle because some of the offshore sites and Google has its own way of determining who gets to be number one. So there's a whole group of people who are really quite expert in how you make that happen. What we're doing with our website, particularly the Healthdirect website, is rather than trying to recreate the wheel, so to speak, and publish all this information that other sites have, we partner with trusted health information providers, and we have an assessment process that we look at their clinical, their content development clinical processes so that we know that the information on that website can be trusted and it's safe to send people to. We partner with them and then we use our site to portal through to them. So that's our strategy to do that, so we can cover the broad health world of topics that people are going to be looking for, which is pretty monumental when you think about it, and connect them to everyone in Australia that is a safe resource. Yeah, we are. It's a significant amount of work to get there, and that's clearly our objective, to get up to number one on Google. But you can't, unfortunately, for a lot of people, I think also when they're online and searching, they don't often realise that they're on an offshore site, that they're not getting Australian health information. And it's about educating the public as well about where's the best place to go for information.
And do you keep data on whether a person's inquiring from a rural and remote area?
Mm-hmm. Yeah, we do. I didn't obviously bring in that. We collect quite a lot of data from all of our telephone services, aside from recording the calls, so we get their postcodes so we know where they're from. And we keep information obviously around what they called about, what their dispositions were, so where we wanted them to go. We also information on their called background or Aboriginal and Torres Strait Islander background, age. Yeah, we have quite a lot of data. Yeah.
Okay, thank you.
Thank you. Oh, over there, taken. No.
It occurs to me that some people might ring up a lot if they're anxious or... So I was wondering, when the person answers the call, whether there's a record in front of them to know that this person rings up every day or has rung up X number of times before. Is that information available straight away? So you might know that someone uses the service every couple of days and you'd already have an idea that the person's anxious, wouldn't you?
We do. Not only do for all of our services, so there's a patient record created. So the calls are recorded, but they also put the patient's data in, and they'll ask them, "Have you rung before?" And they'll ask for their name and their date of birth, and some identifiers to make sure they've got that person and their address, and it will show that they've rung before and what they've rung about. If it's depending on what it is that they're ringing about and which service they're ringing. So if it's, for example, if it's the pregnancy, birth and baby service and they're ringing, they will attempt to refer them, if it's appropriate, to another service that can provide ongoing counselling or mental health support. If it's not, though, sometimes they will continue to take ongoing calls from someone who might have had, a traumatic, I'm going to say a traumatic trauma associated with their pregnancy. I'll just leave it at that. And they're making decisions about what they do with their pregnancy and then ongoing stuff. So they'll stay with them for that. People, though, who may have, say, postnatal depression, they'll want to. We have referral partners like Panda, postnatal antenatal depression. So we'll refer on to people like that. With the nurse triage line, absolutely, there is a record kept so they can see what they've called about before. But again, they will still just go through the symptom-based call and then give them the dispositions on that. But there is records for everybody. And Gail's just coming.
On the websites per state slide, I'm a
Yes.
Queenslander, and it said that the Mind Direct wasn't available in Queensland, but it's a website. When you then put it up, it had website and phone. So can people in Queensland phone up and pretend they live in South Australia to get the service?
Oh, you mean the Get Healthy service? Or Mind Health Connect is just a website. There's no any. I'll show you the site so that was a little bit quick for you. If there was a phone, there are phone numbers on all our websites for people to ring. So it'll be the nurse triage line. That also, like if you need urgent help, there's advice around ringing 000 or Lifeline or things like that. Yeah. When you ring, particularly through to the nurse triage line, if you're ringing from Queensland, Victoria, they'll know, and it diverts back to that state's line. Pregnancy, birth and baby is a national service, though, so it doesn't. You can call from any state, and again, they'll still know where you're coming from, but they won't. Yeah. Oh, one more.
I was just wondering, with how you relate with the back to the emergency services, do you also do the same for GP services as well? Do you collect where the person's local GP is, and do you ever send anything to their GP to say, we had a call from them, did they present, or anything like that?
Oh, okay.
Yeah.
No, we're not doing a data matching with GPs at the moment. It's probably... I'm just thinking about how we could actually do that. What we do... I thought you were going to ask me about giving the information back to GPs. GPs can actually contact if the patient actually turns up at the GP and says that I spoke with Healthdirect, the GP can actually get a copy of that record. There's a whole lot of work going on that's associated with the PCHR around electronic transfer of information and being able to then just securely transfer the client record from the phone call back to their GP so that it's there when they arrive. But it's not functioning from that end at the moment. Having said that, though, if you have a patient comes to you and says, I rang Healthdirect, you can actually contact Healthdirect and get their record with the patient present to do that. So you can get it the other way. It would be a really worthwhile research project to do that, the data matching with GP practices. I'm just not sure how we might go about it. It might be something we'd have to do through the PHNs or Medicare locals, whatever, if the name's changed, if they've moved across. It took us, I think it took us like a year to get ethics approval and to get data matching with EDs across New South Wales. But that's all right. We can do that. We have quite a significant research is one of the things. This kind of research is something that we really want to do. I think it's really, really useful to see what's going on. Oh.
I'm quite familiar with the pregnancy line. I use that for our angionates all the time. Just with the mental health page, how does that feed into the other resources out there? Like you've got, I'm going to say Headspace for the young adults, Beyond Blue, all of those sort of things. Some of the self-help cognitive tools. Yeah.
It acts as a portal to all of those. So all of the major, or even not all the major, all of the mental health providers like Headspace, Black Dog, Beyond Blue are partners with the site, and I'll just quickly just get that down and get the site up. Ooh, there we go. Oh, hang on. So when you go to the Healthdirect website, you can access all of the services across the top. The Mind Health Connect site, you can actually fill in the guided search tool, and it will which is running across the middle of the page here, and it just depends on what you put in there. It will actually bring up a whole list of, there'll either just be online stuff, there'll be Headspace clinics if that's appropriate based on your age. So all of those resources are surfaced by the website for people, and it will ask for, where you are kind of thing. So it's not going to send you to something that's across the country. Yeah, so it localises it. Yeah. It will bring up everything related to what you have put in that you need, that is available around you from all of them. And so, running across the bottom is our partner banner. We partner with, as I said, other trusted health providers, and particularly website health providers for the websites. And we have about 130 partners, so you can go to see all our partners and you can just see who they all are, and you can go to their contact. There.
Are Medicare Locals one of your partners?
They are, they kind of are anyway, because of when I talk about partners with the website, we talk about people who have content on their website that we can surface up. We work very closely with the Medicare Locals, particularly with the after hours GP line and the nurse triage service, and a few linkages projects and things like that. So it's probably we can call it a partnership, I guess, but we work very closely with them. Yeah,
it's a logical area of promotion. Like people also surf the Medicare Local websites for information. And as far as I'm aware, we have no contact. We have no direct link to your service, which is really unfortunate. So primary health networks would be a natural marketing.
Yeah. I'll take that back to Michelle, who's our stakeholder manager, so she'll follow that through. But you're right, that's the place to have it. That wobbles.
As a caller, is it possible to remain anonymous?
So, as a caller, can they remain anonymous? Absolutely. Yeah, particularly with, all of our services, but particularly with the counsellors for pregnancy, birth and baby. So if someone wants to be anonymous, they can. They will ask them for a name so they can call them something, and they can give them whatever name they like to have a conversation. Yeah, and I guess just for interest's sake, without the teenagers who ring pregnancy, birth and baby, and there is no age limit. If someone very young rings pregnancy, birth and baby, they're automatically put through to the counsellor. 75% of them remain anonymous. Yeah, and that's fine. They're getting the support that they need, and then referral onto the right services.
I noticed that you have TIS availability. Are there many people that call requiring an interpreter?
Wow, okay, now I'm racking my brain to find the answer to that question. It's low, it is very low, but we do have some, and we get monthly reports from all our the contact centres who run the services, and our 1-800 numbers are listed with the test, so it's not a cost to anyone to use, because for some other services people have to pay to use that. But yeah, maybe it's around the 1% or less, so it's not big, it's not high numbers, I think.
Can you explain the suicide callback service? Because it seems like if someone's suicidal, they don't really want to wait for a callback.
Okay, I think I do. It's not our service. We don't.
I saw it up there in the
That will be one of the partners. Let me go back to that. Oops, I did not want to do that. Yeah. So that's one of the partners that we have. So it's not a service of ours. So there, yeah. I don't know a lot about them, but if someone has rung up and they're saying that they're suicidal, I don't think it works such that they say, "Well, okay, hang up, I'll call you back." I think they, for want of a better way to put this, talk them down, and then there is a follow-up callback service that happens with it. Yeah.
So your website doesn't provide any callback services. So say if someone, and I understand you've got the ED data connection, but in regards to the triage, if someone is having a heart attack or suspected heart attack or something like that, and they're told to go to the emergency department, or something like suicide, does Healthdirect provide any sort of follow-up call afterwards to see that they went, or to see that the ambulance was called, or
so
do they call the ambulance? Or
if it's an emergent call, such as those, they will call 000 and keep the caller on the line until 000 have picked them up. Once the ambulance have picked them up, though, then they end the call. So once they have them connected to the emergency services, yeah. But there isn't, for any other dispositions, there's no follow-up call to see that people went and did, yeah. But for those ones, they stay on the line with them until they're connected. So yeah, so that they ensure that they're safe, yeah. And the same kind of thing if they reach and go to emergency disposition and people actually aren't able to get there, then they will contact ambulance as well to get them there. So they make if people say, well, I can't drive or whatever. Yeah. Okay. Now I wanted to quickly just show you the symptom checker. There are a couple of really important things I wanted to show you in this online. I know we're due to finish in about 5 minutes, so if you need to run off, please do so. This is the homepage of Healthdirect. You'll see we have a flu meter that's telling people, because people really like to know what's going on with flu in the world. It's on the side there. And that's based on the phone calls to Healthdirect, on people ringing up about the flu and how many calls we're getting and how it's trending. So in the middle, you can see feeling unwell, need trusted advice. That's, in technical terms, called a widget. And it's the symptom checker widget that sits on the website. Incidentally, and to the right of it is the Find a Health Service. That's the NHSD. You can have this kind of thing on your own website. So to go back to the PHN, some of them have things like Find a Health Service on their websites already, and you can have it customised to your own colours and things, so it looks like your site. So you can pick one of these up here, or if you want another symptom check, or you can just click on this button and go, I'm going to start. And what I wanted to show you is that this goes back to that emergency call stuff. This comes up first no matter what you do. So if there's people who are going in who have got emergent symptoms, we don't want them spending time in our symptom checker. We want them to get themselves off to emergency. So if that's this, then you ring 000 and don't go any further, but you're happy, so you're not having a heart attack or you're just in denial, and you keep going. And we know that. So there's, again, a few of the common symptoms you can pick, or you can go to see all the symptoms. Does anybody have someone that they want, like a patient or someone, close to them, that they might like to run through a symptom live? You can give me somebody, or I can make one up. Make one up? All right. Okay. Well, I'm going to have to make one up that's close to my heart. Seeing as I've been a midwife for longer than I can remember, we'll go into pregnancy and contraception. Go next. Oh, you want me to pick one of them? Pregnancy. So it actually, funnily enough, gives you a lot more options than you'd think. We're going to go to pregnancy problems. And you click next. I'll run through this. We do ask The gender will be automatically selected. If you change it to male, you won't be allowed to go any further. Sorry, gentlemen. It's auto-selected to years. You can't be months old and go through this. So some of them in the background have age selection. So you can enter your age. And it actually is selected. There's actually the age band on this is set quite low. So just to not horrify you too much, I'll pretend I'm 17. And you pick your suburb. What's the postcode in Brisbane? 4504. 4504. There you go. Is that right? Yeah. Then go next. And the reason it asks for the postcode is at the end the symptom checker is embedded into symptom checker. The National Health Services Directory is embedded into this. So if you need to go to a GP or a pharmacist, it'll show you the ones nearest around where you are. So if you're like me and you're travelling and you're up here and I've got a pregnancy problem, this will show me I can find someone to help me. And on the far right-hand side, it has a list of your answers. So you can see what you've said and you can change it if you want to. So I'm just going to pretend I'm less than 20 weeks. And then it asks you what are you concerned about. So they're very broad and it's simply put. So I have got, I have to try and make sure I end up at a GP. It doesn't really matter if I end up at GP or ED. I think I'll end up at either one of these. I'm going to have, I hide it very well, but I have abdominal pain and bleeding. You can't tell. Okay, now this question is the shock question. It's asking, and if people say that it's about finding out whether they're cold and clammy, and if they're in shock, it'll automatically send them off to ED. It won't send them anywhere else. But I'm not going to be in shock, so because I'm still standing. And then it asks you questions about severe pain, and there's always a little thing over here. So if you want, why are you asking me that? And that will answer the question. And what does it mean? What is severe pain? How do you define that? No, not in severe pain. Am I bleeding heavily or passing clots? We'll say no. And some of these things, if I answered yes to that, it would again probably send me off to ED. So there you go. And then it gives you what you should do. Oh, sorry. My little mouse on this thing is a little bit touchy. So, and there's some standard text that appears at the top under See Your GP Today. So, and again, it's purely based on what people put in there. You can go in and change your answers to take yourself somewhere else. So it suggests you need to go to your GP. And it always will tell them if you have any further concerns or your symptoms change or get worse, then you need to, before you get to your GP, then ring Healthdirect to get more information so people aren't left out in the cold. When you contact your GP, tell them that you're less than 20 weeks pregnant and have abdominal pain, which is not severe, and vaginal bleeding, which is not heavy. So that you're very clear about what's going on. And then what to do and to rest. And then down the bottom, I'll just scroll down on this screen, the remainder of these tabs. So it always opens up with the National Health Services Directory, so it'll tell me what doctors are open right now and how far away they are and who's closed. And then shows a map. It then has a tab of information, so what to keep watch for, so it tells me when I need to ring 000 and get an ambulance if these things happen, when I should travel to emergency. Now, for all of the pregnancy problem symptom checker that are over 20 weeks, they're never sent to emergency, they're sent to delivery suite. So if I had same kind of thing, pain and bleeding, and I was 30 weeks, it would send me to delivery suite, not to emergency department. And when to call Healthdirect for advice. And clearly, if you're in Queensland, that would automatically defer you to 13 Health, but we just put the one number, it's not confusing for people. There is a self-care tab that tells you what you can do and what you shouldn't do. There's further information just about pregnancy, so that opens up a whole lot of other information in another page and takes you actually to pregnancy, birth and baby site. Oops, sorry. General information about vaginal bleeding in pregnancy and what it means and how many have it, that kind of information. And then the last tab, probably the most important, is your questions and answers, and then you can print that out and take it in. So you can tell your people if they've answered this, print it out, they're the the questions they were asked and the answers they gave to get them to this point. Look at that. Oh, 2 minutes over time. Holding on. Does anyone have any questions, or would you like to look at anything else? I mean, we'll be around a little bit longer if you want to. I meant to point out in the bags are a bunch of our brochures, but the other thing that's in there is a bib, pregnancy, birth and baby bib, really nice bib. So if you've got a baby, you know someone who's got a baby, you can give them one of those. It has the phone number. It's a nice way for babies to let mum know and dad know they need to call for help, and this is the number. Sorry, you had a question.
Just briefly, with the nurses who are referring patients to the service, and for the triage nurses who are taking the phone calls, what's the duty of care? Like in terms of if something does happen for the nurses who are using the service, or, you know, we use this service and then something happened, and also for the triage nurses who are taking the phone calls?
Okay, so there's two separate groups of people, right? So you guys as practice nurses, our duty of care is how do I answer? Is the same. You still have the same, like sending people to the nurse triage, or even to use a symptom checker. You can trust that it's safe because we put significant clinical governance framework stuff around this to make sure it's safe. And your duty of care is to always, as you know, do the right thing by a patient and not do any harm. For our nurses on the line, it's the same thing. It's like your workplace. You follow the policy and you do whatever the policy of your workplace is. With Healthdirect Nurse Triage, they follow the guidelines. There's a lot of training and support provided to them to do that, to know what they do. They also have access to subject matter experts on the line. So if they, for example, had a call from someone who has a significant mental health issue, they have mental health experts that they can bring into the call or transfer the person through, so there's support for them on that. But your duty of care doesn't change. It's the same. But because you're supported by guidelines and the phone calls are recorded for the nurse triage nurses, they can only be found. You're only accountable for what you do within the system. So if someone went right off script and went, well, you know, I'm just going to shut this computer down and not follow the processes of nurse triage, and they gave wrong advice and it caused harm, then they could possibly be in a spot of bother. But following the guidelines and the information we have there, then they are safe to practice. Does that answer your question? Well, yeah. The call centres. So we have different people run our services. So Medibank Health Services are the service provider for nurse triage, and they have a call centre in Sydney, but most of their nurses work from home. So they have a home-based model. So they're everywhere in the country. The pregnancy, birth and baby service that contact centre is in Melbourne. But again, they use because they have the National Health Services Directory and a bunch of other stuff, then they're able to link people into local services without having to be local to find it. Does that make sense? Yeah. And My Aged Care's in Melbourne as well, and Get Healthy's in Sydney. Yeah. My contact centre. Oh, there's one more. Yep. Yeah, that question was about what level of literacy did we set. This is aimed at around the 11-year-old reading level. Yeah, and we're doing a significant body of work on health literacy with our websites, and just looking at how some of the content, it's kind of a balance with health information to give people the right information and keep it written at a level that it doesn't suddenly read like you're at university. Yeah.
Okay.
So the question was around connecting our resources to eHealth. We are funded also through our digital services to do a lot of work in the eHealth space. So The short answer is yes. The detailed answer is I may not have all of that, but yeah, we are. I think some of that work on the personal controlled e-health has come back to us and some people that work with us as well. Oh, when they go offshore, it's kind of hard to say, but a lot of it is US. Some of it will be UK, some of it will be up through Asia as well. But yeah, the bulk of it is probably US. And I guess, when you think of their population size and their website stuff, so there's a lot out there that people land on. And the more traffic a site gets, the more Google sticks it at the top. Yeah. But yeah, the only way to know is look at the web address, and if it doesn't have a .au on the end, you're very likely not in Australia anymore. Yeah.
So I think that's a challenge for each and every one of us in the room to actually promote this site to our patients, because, wow, what an incredible suite of services that Healthdirect offer.